Okay, I'm going to open it up.
Sorry. There you go.
Hi, I'm Lacey Nobles with the City of Lubbock. We will start our news conference in just a few seconds. Hi, I'm Lacey Nobles. Good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. Today's panelists are the Director of Public Health, Katherine Wells, Local Health Authority, Dr. Doug Klepper, and Lubbock Mayor Dan Pope. So let's kick things off with Katherine Wells.
Good day, everyone. I'm going to update you on our current numbers for COVID-19 cases in Lubbock County and also review some of the activities of the health department over this last week. The health department is reporting 674 cases of COVID-19 as of yesterday evening, May 26th. And of these, 452 are fully recovered and 172 are active. Over the last week, the department reported an average of 5 cases a day, which is a slight increase from last week, and the number of active cases has remained steady. These are all great signs. The department is also encouraged that it has now been 4 weeks since Texas started reopening, and we have not seen a jump locally. The department continues to be cautiously optimistic, but we will continue to monitor and we will continue to be staffed 7 days a week. We all must continue our efforts to stay the course. This really is a community effort. We need to limit gatherings, be smart when we're out and about, continue to practice social distancing, and wear a face covering. Remember, wearing a face covering is done to protect others in case you're carrying the virus without symptoms. This week, the health department is also focused on assisting our long-term care facilities to complete the governor's mandate to test all nursing home residents and employees for COVID-19. We are doing this with the help of trained staff from Lubbock Fire and Rescue, and we have completed testing in 4 facilities. That concludes my update for today, and I hope everyone has a great rest of the week. I want to introduce Dr. Douglas Klepper, who serves as the Health Authority for Lubbock County, and he will provide a medical update.
Thank you, Katherine. Dr. Klepper is a pediatrician, and there's something I think we need to talk about with masks. This is my visual I want you to think of today. We have all been out in the community. We've all seen people getting around, and we're all keenly aware of social distancing. But what is very discouraging to me here lately is the lack of masks that is consistent. And as a pediatrician, I think we have a wonderful opportunity to do something for our kids now, particularly in the summer while off, as we anticipate how we go forward in the fall. Okay. I believe that mask is no different than me teaching kids how to wear a helmet. I never get on a bicycle without a helmet. Why? Because I know it's safe. I'm taking care of myself. When we put on masks, we're not taking care of ourselves. We're taking care of our kids. We're taking care of our grandparents. We're doing those things that those people need to do for us. So when I put on a mask, I'm doing it not for myself, but I'm doing it for the others around me. When it comes to kids, the issue comes up, and this has been recommended by the American Academy of Pediatrics, the Center for Disease Control, that any child that is over 2 years of age should be considered a good candidate for masks, because ultimately we're trying to get them in healthy habits. I know I started wearing masks real early on because it made me not want to touch my eyes, rub my face, those kind of things. It's made me much more conscious of that. And that's the first thing we need to think about these masks, is that we're trying to make them safe. When it comes to kids, a couple things that I recommend people that they get kids in a habit to is that, once again, that if we think we have a mask, we need to walk around the house with a mask. We need to show them it is safe to be in a mask and to get around. And I encourage people, sit in front of a mirror, put your mask up on in front of a mirror and talk to yourself. Show them that you can talk through it and that it's okay. Because if kids see you talking through it and see it in the mirror, they know it's not, should help to diminish the threatening influence of that. I encourage people to get their favorite child's toy. That the situation in my case, my invisible penguin here, is to go ahead and make a little cloth mask on that. Include that into their toy box. Help them see that a mask is one of those things that can be a fun accessory. And by teaching it on their favorite toy, that's a very good thing to do. I'm a firm believer that any day with the masks that we get, whether they're the cloth, whether they're the paper ones, that you can make them fun, that you can take a marker and you can bedazzle these masks. That can be their fun item to do with that, making it a fun event for us up with that. I believe that by leading by example, the best thing that we all do anymore is we all have social media, that you can actually take pictures of other kids wearing their mask and show them on a YouTube, kids interacting with masks and things like that, so that they can see that that's the acceptable norm. I do believe as adolescents, obviously they're very conscious about appearance and things like that. But if we know that this is the normal for them, that's something that we can buy into and make it better for us. Draw a picture. You have little kids, they love to be drawn. Draw a picture of a camel or a cow and put a mask on them and show them that that's what it is. And once again, practicing is at home, because I believe just like on my bicycle helmet, the situation, we lead by example. And the best thing we can do is show them that we are responsible adults, and that by wearing the mask, we're making other people safe, not ourselves. We're making other people safe. So I really encourage people to go back to that and make that a habit. So my take-home lessons is kids need masks just like adults. And if people are getting called out because they're wearing a mask, then the people that's calling them out is the one that's doing it wrong. So making good habits is what I want you to all think about this week. Mask, by the way, there are wonderful sites to make masks, from handkerchiefs with rubber bands, from sewed-on ones. I guarantee you, if you go to your church, there's somebody at your church that would love to give you a mask that they've made. There's very readily resources, and they can all fit all sizes of kids. So consider that as we go forward. With that, I'd like to turn it over to Mayor Pope.
Thank you, Dr. Klepper. We're so thankful for you and for Dr. Cook. We're fortunate to have great medical resources that serve as the public health authority for the city and for the county. Thank you for your leadership. I'm going to share my screen and talk about data has become my norm. So let's start with that. Okay, so active cases per day. The trend continues to be a positive here. That is, we have many fewer active cases than total cases. In fact, less than half as many active cases as total, a third now, I guess. Continues to trend, goes the right way. An active case, once again, is that's total cases, less recovered and less deceased. And so a great trend line there. New cases by day. So we've only had one occurrence since in this month where we've had more than 10 new cases. That was last week where we had one day of 11. But remember that, as I'll talk in a minute, we're testing more. So this is a very good trend. Hospital capacity remains very strong. And finally, and this is the slide I alluded to a moment ago, but remember the blue lines are our testing. The trend is very positive. You still are about twice as likely in Lubbock County to have been tested as if statewide. But even as we test more, the red line on the bottom is our percentage of positive tests. That remains very, very low. And that's what we're looking at locally, statewide. That's what the governor's looking at. And that's a national number that's being followed very closely also. Okay, I believe I'm back now. And let me make just a few more comments as it pertains to our overall performance as a community. First of all, reopening is going very well. We have more than 800 businesses that have, or organizations that have self-certified that they're Lubbock safe. That program has gone fantastic. There's great guidelines there for our businesses, and I'm thankful for our Economic Recovery Task Force and their continued work. Right now, they're working around on mass gatherings and what does that look like? What does school reopening look like? So if you're thinking we've dispatched them, we have not. We're still heavily relying on their expertise and their collaboration. We opened gyms a week ago yesterday, or a week ago Monday, I guess. Many of those gyms are Lubbock safe. In fact, I'm going to visit one of our gyms this afternoon that invited me to come out and see how they're going about their efforts at reopening. But that's gone very well. And I think so much of that is the credit's due to our citizens who've taken safety very seriously, as have our business owners. We're going to continue to test. We're going to continue to trace, and we're going to continue to tweak our strategies. We learn more every day. We learned last week a little bit more about how well the virus survives on hard surfaces. It's maybe not quite as active there as we thought it was, but we will continue to learn. I hope you're following the progress locally and or nationally and internationally around a vaccine. There's very good progress being made, and I think there's real reason to be hopeful. So Lubbock, I really encourage you to let's not let our guard down. Let's continue to make good decisions. Let's reopen safely, but let's reopen. It is safe to get out. Dr. Klepper shared some ideas about how to safely leave your home, but let's get out. Let's visit our businesses. Let's visit our stores. Let's visit our restaurants. Let's enjoy our life. Let's go to the park. Let's ride our bikes. Let's go for a walk. Let's enjoy our spring, soon to be summer weather. Be safe, be kind, and be hopeful. Katherine, back to you. Excuse me. Lacey, back to you. I'm looking at Katherine, talking to Lacey.
All right. Thank you, Mayor Pope. Okay, we'll open it now for media questions. And our media order today will be Matthew Stell, KMAC, Sarah Self-Walberg, TTU Public Media, Christy Martinez Garcia, Latino Lubbock, Karen McKay, KCBD, Terry Furman with KLBK, Matt Dotre, the Lubbock Avalanche Journal, and Olga Guerro, El Editor. So let's start with Matthew Stell.
Thanks so much, Lacey. My first question is for really anybody. We haven't went above 50 deaths. We haven't had any new deaths in over a week. That is very promising. I'm assuming the same for everybody else. If anybody want to speak on that, I'd love to hear that.
Katherine, why don't you talk about that?
That is correct. We haven't seen any deaths associated with COVID for quite some time now. And again, that's very promising. And I think it goes to show that we're really protecting those that are most vulnerable. I'm not seeing as many cases in those older individuals like we were seeing early on. And I think that's a good sign for Lubbock.
And secondly, I know we've got some more remdesivir that has hit our area. Just a quick question, what hospitals specifically have the remdesivir drug?
I don't have the details on exactly what hospitals are receiving that. That comes through the hospital emergency preparedness through Health and Human Services. And I know that they're distributing it among many medical facilities all throughout this area.
Dr. Klepper, you want to add to that?
I can't speak to that briefly. I've been on some teleconferences in both hospitals, and both hospitals do have that drug available. It is very limited. It is in a very controlled environment. People will qualify for it in certain realms, but both hospitals do have that drug available.
Thank you, Dr. Klepper.
Thank you.
Okay, now we have Sarah Self-Walberg with Texas Tech University Public Media.
Hi, everyone. Mayor, you kind of touched on this, but after the long weekend and as we are a few days into the second phase of reopening, have you gotten much feedback on how that's gone from citizens so far?
Hey, I have. Thanks for asking that question, Sarah. I probably should have elaborated on it, both from citizens and from business owners. I think our restaurant owners had a pretty good weekend. I think particularly the outside dining has become very, very popular. We've had good weather and save a few thunderstorms, which we're very thankful for. I think our residents are going out to eat. I talked to someone this morning who spoke of going to a restaurant on either Sunday night or Monday night and having to wait in the car. They had a party of 7. They were going to split up into 2 tables. They had to wait in the car. while the table opened up for them. But I think we get better and better every day. I think from a standpoint of people feeling safe about getting out, we still get lots of citizens calling us and asking us questions or making suggestions, and we continue to work real closely with our businesses. So, it's hard for me to judge any more than that. We'll see some sales tax data in a couple of weeks, but that'll be April data. That lags about 6 weeks. So, but I think anecdotally, I think things are positive, Sarah.
Wonderful. And then kind of going off of that, kids are out for school officially. Weather's been nice. We're going to see a few changes with summer activities kind of coming back. Any general advice for, being outside or, going to a barbecue, things like that? What are some good common guidelines people should be following?
I'm going to start and then let Dr. Klepper finish. The CDC's done a nice job in putting guidance out along youth sports, restaurants. And there's great guidance. Some of it's from the CDC, some from industry. I would say first and foremost, common sense. I mean, let's clean what we're using. Let's keep our distance. Let's wear face coverings as possible. But let's enjoy the sunshine. Dr. Klepper, what do you want to add to that?
You're right, Mayor. The situation, CDC's got some great guidelines. It even talks about summer camps and what's a reasonable thing for summer camps, for organized sports like baseball, soccer. It really comes down to some of these sports we can work around. And I encourage people to get out and do that. If I was playing badminton, an old person like me, badminton, we could do great social distance with that. But if I'm going to be a basketball player and I'm going to be the next Moretti, I'm not going to be such a good social distancer. So I'd have to adapt my basketball game. I have kids coming in here all the time and they're working on skills. They're going to get ready when they can group together. But then when you get that group together, you're going to want to control the sizes. You're going to want to have 8 to 10 people with a little distancing on those kind of things. And those are things that we're continuing to evolve. I'm very happy that the state, in particular our city, is following those guidelines, because those national guidelines are from areas that are much more severely affected than us. And they've learned from that experience, you can do some of these with some local common and understanding. So yes, I encourage you, get out. We get a group of widow ladies in our back porch every Thursday night because we all sit 6 feet apart from everybody. They come in through the back gate and we feel safe about that because we're using what Dr. Mayor says, common sense. Just a little common sense will go so far on this. One thing I did think about early on with me talking about masks, and I'll just add this, Mayor, I'm old enough that I remember when we first got seat belts in our car. And I remember everybody didn't think that was a very good idea and that nobody'd ever do that. Well, guess what? I can't imagine our kids ever growing up not wearing a seatbelt. Just like I think our kids need to learn at this point in age, we need to learn what masks, we need to learn the social distancing.
Thank you, Sarah. Now we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. My first question is, what's the process on how you're going to manage those who will be visiting the Montelongo and May Simmons pool? Aren't these pools in under-tested neighborhoods with vulnerable populations? I mean, are their temperatures going to be taken? How are you going to social distance them? And I'm pretty sure you can't wear a mask in the pool.
Yeah, so we will develop there are some guidelines. Actually, Dr. Klepper mentioned them. There are actually already some very good guidelines around pools out. We will be developing our local protocols, and those will be in place at the 2 pools that we will be opening in mid-June. Dr. Klepper, you want to add to any? I know you're not going to run the pool, Dr. Klepper, but what would you add from a safety standpoint?
And once again, common sense. And I guess something also, Christy, is that when you say that population's at risk, they are no more at risk than anybody else in Lubbock, Texas. If you look at the demographics of the people that have been infected, that group is affected, but percentage-wise, it's no different than anybody else here in town.
I did mean ethnically, but let me go ahead and go on to my next question. And Mayor, this is probably for you. Beyond survival, economics, resilience, what's the most significant thing that you've learned about the citizens in the last 90 days in terms of needs and inequities in all sectors of the community and needs for improvement in healthcare, poverty, cultural competency? And after this pandemic, do you think you're going to strive to better know the needs of all the citizens beyond the circles that you move in?
Well, that's a lot of question there, Christy.
I know, but
Here's what I've learned. I've learned that, and this is something that's been reinforced. It's not a new learning. I've learned that Lubbock citizens really care. And I don't care if you live by the airport or at University and 130th Street, they care. And so age, whether they're young, old, brown, black, white, they care about themselves, they care about their families, they care about their neighbors. And I think you see that in the way we have responded to COVID-19. Now, specifically to inequities, there are parts of our community that have more medical services than other parts of our community. That's by nature, and that actually builds efficiency into the system. I think we've done a very good job of providing testing, and we will continue to do that. In fact, we're talking as we speak about how we continue to enhance testing capabilities. We accepted some federal dollars last night that will help us with that. Testing is not going to go away. Until we have a vaccine, we will continue to test, we'll trace, we'll tweak our strategies.
Thank you, Christy. Now we have Karen McKay with KCBD.
Good morning. My question is, a lot of people have gone to take the antibody test. So how many of those are coming back positive, and what does that really tell us?
Dr. Klepper, you want to try to answer that one?
I don't know those numbers. I know Katherine will get a better sense of those numbers of how many have taken it. The question is, Karen, how good's the antibody test, and does it really give us a sense of that silent carrier out there? And are we on the backside? It's still so early that I'd like to tell you that, Karen. I mean, there's literature that says the antibody test, some of us will never show positive. I mean, we see that already in healthcare workers who get the vaccine for chickenpox. We've been using the chickenpox for years. You can still take antibody tests. And so, gosh, I know I got the 3 shots. My antibody's still negative. What do I do? Well, they have some sort of immunity, but that antibody test is not going to be positive. The same thing is true of the COVID test. And this test is so new that we can't look you in the eye and tell you the validity of that test being if it's negative, is it truly negative? So it'd be nice to know if we saw a big number out there of people of silent carriers, but at this point, it's still too early for it to tell you that's a reliable indicator of illness.
And Dr. Klepper, as long as I've got you, I have one more question for you. The president has been criticized for taking hydroxychloroquine as a preventive measure, and some viewers have complained to us saying the media has not been fair about this, that they're saying it is safe and even used in pediatrics at times. So that's why I want to ask you, can you explain, is this used for frontline workers, and do you think this is a safe drug? What do you think about this drug that the president says he has been taking?
It's definitely
for COVID-19.
Yeah, it's definitely used. There's no question that people got their prescriptions early on when they heard that might be the saving grace, that we should all be out on with that. I do not take it. I take it simply because I'm a gray-haired old doctor who has seen that we have done things from an emotional point. And I've seen in the past where we've given drugs that have been much more studied for many, many illnesses, that we took off within 6 months or a year later because the side effects far outdistance any benefit for us with that. That's my word here, Karen, is that be cautious. I know there are healthcare workers out there, people I know that started their own prescriptions, and we do use it in kids. It's very much needed in kids for certain autoimmune diseases, but we still don't have enough evidence to say this is what's going to keep people less ill from COVID. That's not out there. If you just look at what the World Health Organization came out with last week, very cautious about using it and say those side effects are worse than the benefits. It's going to be one of those things we'll have to find down the road. I don't encourage any of my parents, any of my patients whatsoever to get on that, even if they have exposure. but that's my population. I think we need more scientific evidence. I am taught do no harm. Giving that has the potential of doing more harm than I can see benefits right now here.
Thank you, Karen. Now we have Terry Furman with KOBK.
Good morning, everyone. My question is this, and this may be more geared towards Katherine. We are seeing more cases, I guess, in women than we are men. Is there any sort of underlying reason for that, or do we understand why that is?
I don't have a great answer for that. It's something that we really need to study. I think part of it is some of the workforce where we're seeing COVID cases, especially when we're looking at nurses' aides and some of the individuals in the nursing homes or the workers in the nursing homes, that tends to be more women. And I think that might have skewed our numbers early on.
Okay, very good. My other question is this, and probably back to you, Katherine. We are looking at, more community spread in the last few weeks, even with the small numbers that we're seeing. Is there anything that those community spread cases have in common as far as where they were caught?
No, community spread really shows there when we complete the investigation and there is no known contact with another COVID case. That's when we categorize them as community spread. There's not an individual place or somewhere that they're all going to. And if we were to see that, then we would announce that as one of our locations where we've seen cases.
All right, very good. Thank you.
Thank you, Terry. Now we go to the Lubbock Avalanche Journal with Matt Dotre.
Thanks, Lacey. Hey, everyone. Dr. Klepper, kind of want to put you on the spot about masks. So you kind of compared it to seatbelts. Do you think masks should be mandatory, just like seatbelts?
If I'm out in public, absolutely. I think it definitely is mandatory. That's definitely guidelines, and it's a habit. Once again, I'm not doing it for me, Matt. I'm doing it for you. I'm saying if I have a silent carrier, I have some disease, I don't want to be the responsible one for you. So yes, I do, sir. Do I take my mask off of my car? You bet. Do I take my mask off if I'm going to United? I do until I hit that door, and that mask is immediately on. It's interesting. We talk about the swimming pool. I agree. I'm not going to be wearing a mask at a swimming pool, but I'm going to go in my little waiting pool in the back, and I'm going to have that mask if I've got other people around me. Yes, sir, Matt, I do.
Mm-hmm. Thank you. And Ms. Wells, I wanted to ask you specifically about the Patterson Library testing. Can you talk a bit about how many tests are being done at the Patterson Library, maybe on a daily basis? And if that's kind of if that's trending upward, if that's trending downward, just talk a bit about the testing at Patterson Library, please.
Yeah, we're seeing anywhere between 5 to 25 individuals being seen at that clinic. With some of these evening thunderstorms, I think we've had a fewer numbers showing up at the clinic, but we want to continue to have that at 3 days a week and have that available to our community. We've never gotten to a point where we've had to turn people away from that clinic. We've never fully booked it. So I really encourage those who want to get tested to call the health department, 775-2933, to get an appointment at that clinic. And we're operating Monday, Wednesday, Friday afternoons right now.
Okay, thank you, Matt. Now we have Olga Guerro with El Editor.
Good afternoon, everybody. It's good to see everyone. And it's good to see Dr. Klepper. How you doing?
I'm well, thank you.
Good. I have a question as for the mask. I know this past weekend, we even had relatives that went out of town and came back and they wanted to get together. So your suggestion is even if you do not live in the same household, but you're still relatives and you get together in a small group, you should, and it's wise to wear your mask. Am I correct, Dr. Klepper?
You are. Let me use an example. So my parents live up in Kansas, and they get a lot of their medical care at a wonderful Lubbock community healthcare because I can fix them up with good providers. They came down here 2 weeks ago so they get some medical care. When they came to my house, they immediately had their mask, and the only time they took their mask off of that at my house in Lubbock, Texas, coming from Kansas, was when we were in the back porch or we were sitting in different rooms in my house. So I believe that you cannot ever overdo that. And I did that for their benefit, not mine. I didn't want them to be responsible for something I could expose. And in Kansas, they have an outbreak where they've at. I didn't want them to be responsible for giving it to our community also. So yes, and your family will love you. I guarantee you. You can have all kinds of colorful things, you know, to do that. They'll love you more because they know you're being responsible for them.
Yes, sir. Thank you. The second question, I guess it goes to the mayor. You know, we say we're all together in this. So that means we're all looking out for each other. Would you advise people in general or the citizens of Lubbock that do we report or where do we call or what do people do when they see a large group of people in maybe like in a business or they question it or at a tattoo place and they just see all these cars around that building? What do you advise the citizens to do, Mayor?
Well, if they just see a number of cars, I don't think they need to pick up the phone and call. If they observe something that they feel like is not right, the first thing I would do as a citizen would be to ask the business owner if they've got their safety precautions in place, their protocols in place, and if they're following them. If they don't feel comfortable doing that, they can call the non-emergency line at LPD and we'll send someone out to check on things. We want people to feel safe. And if someone feels that they're unsafe, then let us know. What we don't want to have is the people that call us just to tell us that people aren't wearing face coverings. I mean, Dr. Klepper's made a compelling case today for that, but that's not mandated. And regardless of your personal opinion, if a caller, sees people not wearing masks and they want to call us, that we can't tell someone they have to wear a mask. We're encouraging that. So we want communication where people don't feel safe, where they don't feel like something's being done right. Let us know. We'll see if we can't work with the business.
Okay, and that's all of our media questions. And this concludes our news conference. Thank you all for joining us, and thank you to our interpreters and our panelists, and thank you, Dr. Klepper, for joining us today. We'll see y'all next week.